Hello everyone. For tonight's video, I'm going to be showing you some exercises and activities that you can implement to help manage neck pain and headaches. A high percentage of people report having neck pain and often see their doctor or physical therapist to treat it. However, much of this pain is caused by things we do throughout our day, such as bending forward when working on a computer or how we position when we sleep. This video will tell you what to look out for, what you can change to avoid irritating your neck and spine, and what activities you can do throughout your day to not only improve the discomfort, but also to gain range of motion and mobility back to your neck. So let's go ahead and get right into the video. I want to start by thanking the sponsor of today's video, BetterHelp. I myself have worked with a therapist from BetterHelp last year when I had just gotten out of a difficult relationship. And around the time that my dad passed away, I really connected with my therapist, and she provided me with incredible advice and new perspectives that allowed me to process and tackle my struggles with a new light. She also provided tools and material to assist and allow me to practice forming new mental health habits and behaviors. I have become so much more capable with managing my own stress and noticing when I start to have an off day, and I use the tools I was taught to improve it. It helped for me to think of therapy as a tool for personal growth. It helps you to better understand yourself, develop healthier habits, and learn effective ways to cope with and solve problems, leading to improved mental and emotional well-being. You don't need to have a diagnosed condition to benefit from therapy or worry about any bias. Seeking therapy takes courage to acknowledge when you need help and to take steps to improve your mental health. While therapy can be costly and difficult to schedule, there are affordable and available options like online platforms. BetterHelp is a platform where therapists and their clients can communicate effectively and get the most out of therapy. There's a journal inside the platform for personal reflection, and there are group sessions on a number of different topics available every day. Starting therapy is easy with BetterHelp. Fill out a questionnaire and you will match with a therapist in as little as a couple of days. One of the best features of BetterHelp is that if the therapist doesn't feel like the right fit, you can easily switch to another one until you find someone you really connect with. If you're struggling and think you would benefit from a therapy session, click the link in the description or go to betterhelp.com/Aaron and get 10% off your first month of therapy. Thank you again to BetterHelp for sponsoring this video. There are a few questions and things I want you to consider before performing these activities or adjusting anything. If the answer is yes to any of the following questions, do not continue with the activities without first seeing a doctor or physical therapist to do an in-person evaluation. 1. If you have associated neck or upper back pain, meaning that you are experiencing pain in other areas simultaneously. 2. If you have severe pain in the arm below the elbow and experience sensations of weakness, numbness, or pins and needles in the hands and fingers. 3. If you have suddenly developed shoulder problems following a recent severe accident, such as a heavy fall onto an outstretched arm, resulting in a major loss of movement or visible bruising. 4. If you are generally feeling unwell in conjunction with your shoulder pain. 5. If you have a previous history of cancer or a tumor. 6. If you develop chest pain with activity or have a history of cardiac or heart problems. 7. If you have had shoulder surgery in the past 6 months. 8. If you have a history of repeated dislocation of your shoulder or have dislocated it recently. 9. If you have pain near or at the wrist or hand and experience sensations of pins and needles or numbness in the fingers. 10. If you have developed neck problems following a recent severe accident. 11. If you have developed headaches recently, in this case, your eyes or prescription glasses may need to be checked. 12. If you experience severe headaches that have come on for no apparent reason, never cease, and are gradually getting worse. 13. If you have severe episodic headaches that are accompanied by nausea and dizziness. Again, if you are experiencing any, especially multiple of these, please seek in-person attention before performing these activities. We are going to review common symptoms related to pain that is being caused by the cervical spine, as well as symptoms of headache that are related to cervical spine causes. If you are experiencing a one-time initial event of neck pain, this is commonly felt at or near the base of the neck, in the center, primarily to one side. These pains will usually dissipate within 1 to 2 days of onset. If you are experiencing recurring neck pain, this is commonly felt at the top of one shoulder or within the shoulder blade, or may reach across both shoulders. Chronic neck pain, meaning that it has persisted for multiple weeks, months, or even years, may be felt on the side or back aspect of the upper arm, and may even extend down to the elbow. The pain may extend further down to the wrist or hand, with numbness and tingling, which is often described as a sensation of pins and needles present in the fingers. If you are someone who experiences headaches, there are a few sites of onset that are associated if caused by the neck or cervical spine. If you commonly experience headaches that are felt at the top and base of the neck or at the back of the head, primarily to one or both sides, this is a sign of headaches being caused by cervical spine issues. Other common headaches include occipital headaches, which are felt extending from the base of the back of the head to just below the crown of the head. A total headache is felt across the back of the head over the top to above or behind the eyes, primarily to one or both sides. A frontal headache is felt across the forehead and behind the eyes. Lastly, a circumferential headache, which is felt around the head and often described as feeling as if there is a tight band around the head. If you experience any of the symptoms mentioned, try to think back to when you commonly notice the symptoms occur. For example, when working, reading, etc. We are now going to discuss common causes of cervical spine or neck pain. These can be how we position ourselves or our posture throughout the day, our sleeping positions, our recovery positions, and our working positions. Common considerations for stressors and postural neglect include sitting with poor posture for prolonged periods of time, lying or sleeping in an awkward position, particularly the position of the head, working manual labor, especially in strained positions, or even sitting in a car or other motor vehicle for extended periods of time. Considerations to our sleeping position is important as well, and to tell of whether this is impacting you is if you commonly wake up with morning stiffness. If you wake up in the morning with pain or stiffness in the neck that was not present the night before, the surface you are lying on or the position in which you lay may be the cause. Tossing and turning throughout the night or changing your position while asleep may also be occurring, which could alter your position and cause pain and discomfort when you wake. How we relax after intense exercise and sporting events is also an important factor. Spinal joints that have been exercised are more prone to be distorted if they are placed in stressed positions or are overstretched for prolonged periods of time. After activity, we rest in these suboptimal positions, such as sitting with a forward head posture or hunched over. Neck pain may occur. Often, the activity itself is blamed for the pain, as people fail to consider their position after the activity. The last consideration is our working position and working in cramped or awkward spaces. when forced to work in these uncomfortable and strenuous positions for prolonged periods without being able to adjust. Pain and limitations may develop as a result. Common positions of concern include working above head, such as mechanics often do, and precision work requiring static sitting positions, such as a dentist often performs. So what can you do and implement to improve these concerns? We'll start with how you can manage pain from postural stresses due to prolonged sitting situations. We will dive deep into each of them, but primarily we want to focus on sitting in the chair correctly, adjusting forward head posture, and regularly altering prolonged neck bending. An important note here: when you begin making these adjustments I'm about to share in the procedures to correct the posture of the neck and lower back, there may be new pain or discomfort that you experience that is different from the original pain that you felt, and in new locations. This discomfort is a result of performing new exercises and working out new muscles to maintain these positions. This is expected and should wear off within a few days. Once you start sitting appropriately, you will begin to enjoy it and experience reduction or complete absence of pain and discomfort, and will automatically start to search out chairs that allow you to sit correctly and optimally. Let's start with what, how, and why of sitting correctly. With this, the goal is to maintain the natural curvature of the spine that is present in your low back while standing. This can be done with a chair that provides lumbar support, or with the use of a lumbar roll that is made of foam and no more than 5 to 6 inches in diameter. This is an important procedure because if the low back is allowed to slouch, it is impossible to sit with the head and neck in the correct pulled back position. This uncorrected habitual poor posture causes changes to the structure and shape of the joints, resulting in excessive wear and loss of elasticity. This may lead to premature aging of the joints and spine. We will learn how to appropriately retract the head while in the sitting position, which will be activity 1 later in the video, so that we can begin improving posture and prevent injury and future pain. This is important because when we work or sit in a chair for prolonged periods of time, our heads begin to protrude as you relax or concentrate on anything other than your posture. For example, when talking to someone, reading, typing on a computer, driving a car, eating or watching TV. We are now going to discuss the importance of adjusting the forward head posture. To sit comfortably and appropriately, you must hold your head just short of the extreme retracted posture. I will show you this when we discuss the activities, but in order to find this optimal position, you start by retracting the head as far back as you can, as shown later in activity 1, and then releasing the last 10% of the movement. This may take up to 2 a week to perform comfortable and master, but is well worth the effort. The third consideration is regularly altering prolonged neck bending. To counter prolonged neck bending, frequently interrupt the forward head posture by adjusting your neck posture appropriately with retraction and extension of the head and neck. We will again discuss these further later in the video, but we'll be referring to activity 2 and activity 1 here. A reason this interruption is so crucial is because when sitting for prolonged periods of time, we start to protrude the head in a position where both the head and neck are in a forward bent position. This interruption will relieve the stresses on the surrounding tissues and the discs that are between each vertebra. Next, we will move on to positional considerations for when lying down or resting. Once again, we will do a deep dive into each, but it is important to be aware of and listening to morning stiffness and pain. Adjusting our resting position and posture as appropriate and sleeping on the correct sleeping surface. Regarding morning stiffness and pain, if you notice that you are waking up in the morning after a night of rest, stiff or with pain, there is likely to be something wrong with the surface you are lying on, or position you assume while sleeping throughout the night. If you do not notice a pain that was not there previously, or stiffness that was not present the night before, this is a red flag that you may have slept in an inappropriate position. It is relatively easy to adjust the surface on which you are laying, but may be difficult to control tossing and turning at night. However, it is important to assume the best possible position to prevent pain and joint damage. Moving on to adjusting your resting position and posture. Lying on your back or side provides the best position and support for your neck and head, and should be accompanied by proper sleeping surface and pillow positioning. Tossing and turning throughout the night is difficult to change, but needs to be considered. To avoid tossing and turning throughout the night, you can place pillows between the legs or behind your back. You can also hug a pillow to not allow the trunk to rotate. Incorrect positioning, particularly when lying face down, places the head to one side, placing the joints of the upper neck in their maximum range of motion and end range. This places great strain on the soft tissue and joints of the head and neck. Lastly, working to find the appropriate sleeping surface. Your pillow should support both the head and neck, filling the natural contour of the neck between the head and shoulder girdle. The pillow should not tilt or lift your head up, and your head should rest in a disc-shaped hollow. The material and thickness should be appropriate. Feather or down pillows allow to adjust for a hollow and create a bunched-up edge to perform a thick support for the neck. Use of a cervical roll placed in the pillowcase at the top and base of the pillow may be used as well. Allowing the head to tilt or lift places the tissues and joint of the neck and head in a strained position, leading to breakdown over time, as well as pain and stiffness. To maintain full and appropriate range of motion of the joints, we want to allow for optimal resting position and alternate sides if able. Often, our body will wake up in the middle of the night if it is in an uncomfortable or painful position. There are two considerations as they relate to managing pain due to recovery positions chosen after strenuous activity and awkward static working positions. When considering the impact of our chosen positioning when relaxing after physical activity, we need to be aware that exercised joints and tissues, particularly of the spine, easily distort if they are placed and held in overstretched or strained positions for long periods of time. To avoid resting in an inappropriate forward head position, start by retracting your head as in activity 1, which we will be reviewing later, and extending the neck as seen in activity 2. We want to perform these activities 5 to 6 times each after intense exercise, especially involving loading and movement of the cervical spine and neck. Often, the activity itself is blamed for causing pain or discomfort, but in most cases, the pain is produced from the prolonged forward bending of the head and neck that we hold during recovery or while catching our breath. If you have an occupation requiring or must work in awkward positions for long periods of time, such as mechanics, dentists, etc., it is important to interrupt this position to place your head and neck in the correct position and posture. To avoid holding these positions of strain, frequently interrupt the position by performing neck flexion, as seen in activity 7, that we will discuss later. Perform this activity 5 to 6 times each when you notice discomfort accumulating or throughout the day to prevent pain and strain. If we continue to place our head and neck in these static positions, our tissues and joints may become strained or tight, and restrictions of movement due to pain or contracture may begin to occur. A contracture happens when a muscle is not stretched past a certain point for a long period of time. It loses its elasticity to stretch. We are now going to begin discussing and reviewing the activities to perform for improved range of motion, pain, and posture. First, I want to share some information on the purpose and considerations to be aware of before, during, and after beginning the exercise routine and activities that will help improve and prevent cervical spine or neck and headache pains. Please listen carefully, especially to the considerations. The purpose of these exercises is to restore normal function of tissues and joints to regain full range of motion and mobility of the cervical spine. They will also provide pain relief and reduce symptoms of headache, as well as improve stiffness from postural stresses and improve resting posture. These activities will also assist in preventing further or future tissue and joint damage and discomfort. A consideration is the effect on pain intensity and location. It may increase or decrease the intensity of pain and symptoms you experience, or the pain and symptoms you are experiencing may move from where you originally felt them to another location. Important considerations are, when performing the activities, move until you begin to feel the pain and discomfort, and then return all the way back to the starting position. When performing the activities with overpressure, use hands to gently but firmly apply pressure to move through the full range of motion. Following the activities, always assume correct posture and maintain this position. A few precautions. It is important to pay attention to the pain and any changes in the location that occur during the activities. You may notice that pain originally felt to one side of the spine, across the shoulder, or down the arm, moves towards the center of the neck. This is called centralization and is a positive effect of the treatment. Initially, when starting the activities, you may notice an increase in symptoms. This should be followed by centralization or decrease in pain. Once your symptoms begin to centralize and is felt in the midline only, the intensity of pain will decrease quickly, usually within 2 to 3 days, and then disappear shortly after. If you notice your symptoms worsen or spread further down the arm, this is called peripheralization and is a negative effect of the activities. Especially if felt below the elbow into the wrist, you should seek advice from a licensed therapist or physician for an in-person evaluation. We will now start the activities and guidelines for how and when to perform the treatment. Please refer to this portion of the video if you are unsure of proper form to avoid injury or worsening of symptoms. Listen to your body and pain and take note of symptoms before and after so that you can track progress. Let's get started. Activity 1, head retraction and sitting. Retraction refers to pulling the head backwards, creating a double chin. How to perform? Start by sitting up in a chair or supportive surface, looking straight ahead. Relax completely to a comfortable position. This will result in your head falling forward or protruding. Next, move your head slowly and steadily backwards as far as you can manage. Be sure to keep your chin tucked down and in, remaining to look straight ahead. Do not tilt your head backwards or look up. This is the retracted position. After holding for a few seconds, relax and the neck will fall back into the forward position. Repeat the activity, making sure to go through the full range of motion that is manageable. Overpressure may be added with the use of your hand or both, placed on the chin and firmly pressing. When to perform? Perform this activity primarily for treatment of cervical spine or neck pain. For treatment of neck pain, perform the activity 10 times per session, 6 to 8 times throughout the day. For prevention of neck pain, perform the activity 5 to 6 times as often as needed or when symptoms begin to appear. Activity 2, neck extension and sitting. Extension refers to bending the head backward or looking up toward the ceiling. How to perform? Start by sitting up in a chair or supportive surface. Look straight ahead. Perform activity 1 a few times, and then remain in the retracted position. Lift your chin up toward the ceiling while tilting your head backwards into extension as far as you can manage. Do not allow your head to move forward or protrude. With your head in the extended position, rotate your head side to side about 1/2 inch each direction away from midline, using your nose as a reference point. With each attempt, aim to extend your head further backwards. Perform the activity rhythmically and not too slow. After a few seconds, return to neutral starting position. When to perform? Perform this activity for treatment and prevention of cervical spine or neck pain. For treatment of neck pain, perform the activity 10 times per session, 6 to 8 times throughout the day. For prevention of neck pain, perform the activity 5 to 6 times as often as needed or when symptoms begin to appear. Once you are able to perform activity 1 and activity 2 appropriately, you may combine them to first start in retraction and then extension with side-to-side rotation. Activity 3. Side bending of the neck. Side bending refers to bending the head to the side so that the ear is moving towards the shoulder. How to perform. Start by sitting up on a chair or supportive surface, looking straight. Perform a few rounds of activity 1 and then hold your head in the retracted position. Keep your head retracted and bend your neck to the side so that your ear is moving toward your shoulder. Start by moving to the side you feel the most pain. Remain looking straight forward and do not allow the nose to turn toward the shoulder. You may apply overpressure by placing the hand of the painful side on the top of your head and gently but firmly pull your head further toward your shoulder. After a few seconds, return to neutral starting position. When to perform. Perform this activity for treatment of pain felt primarily to one side of the cervical spine, or when pain felt more to one side than the other does not improve by performing activities 1 and activity 2. For treatment of neck pain or stiffness, perform the activity 10 times per session, 6 to 8 times throughout the day. For prevention of neck pain, perform the activity 5 to 6 times as often as needed or when symptoms begin to appear. Activity 4. Rotation of the neck. Rotation refers to turning the head to one side so that you are looking over the shoulder. How to perform. Start by sitting up in a chair or supportive surface looking straight. Perform a few rounds of activity 1 and then hold your head in the retracted position. Keep your head retracted and turn your head over one shoulder as far as manageable, and then repeat to the other side. If you are experiencing more pain to one side, focus rotation to the painful side. The pain should gradually centralize or decrease in intensity. If the pain begins to increase, focus rotation to the least painful side. Once the pain is equal or absent and only stiffness is present, continue to rotate to both sides. You may apply overpressure by placing one hand on the chin and one behind the head and applying overpressure further into rotation. After a few seconds, return to neutral starting position. When to perform. Perform this activity for treatment of pain felt primarily to one side of the neck, or when pain felt more to one side does not improve by performing activity 1 and activity 2. For treatment of one-sided neck pain, perform the activity 10 times per session, 6 to 8 times throughout the day, always performing activity 1 and activity 2 after. For prevention of neck pain, perform the activity 5 to 6 times as often as needed or when symptoms begin to appear. Activity 5. Neck flexion and sitting. Flexion refers to bending the head forward so that the chin touches the chest. How to perform. Sit up in a chair or supportive surface, looking straight ahead. Relax completely to a comfortable position. This will result in your head falling forward or protruding. First, perform a few rounds of activity 1 before beginning. Allow the head to drop forward so that the chin touches the chest or gets as close as possible. You may apply overpressure by interlocking your fingers and placing them behind the back of your head. Allow your arms to relax so that the elbow is pointing downward toward the floor so that the weight will provide an additional stretch to the tissue around the back of the neck. If manageable, you can firmly pull your head onto your chest. After a few seconds, return to neutral starting position. When to perform. Perform this activity for treatment and prevention of headaches or to resolve residual neck pain and stiffness after acute symptoms are gone. For treatment of headaches, perform the activity 2 to 3 times per session, 6 to 8 times throughout the day. For treatment of neck pain, perform the activity as above, always performing activity 1 and activity 2 after. Activity 6. Head retraction and lying. Retraction refers to pulling the head backwards, creating a double chin. How to perform. Lay on a supportive surface on your back at a freestanding edge of the bed. Rest your back flat with head and shoulder touching if able. Do not use a pillow. Move your head slowly and steadily backwards as far as you can manage, pressing your head into the bed. Be sure to keep your chin tucked down and in, remaining to look straight up at the ceiling. This is the retracted position. After holding for a few seconds, relax, and the neck will fall back into the neutral position. Repeat the activity, making sure to go through the full range of motion that is manageable. When to perform. Perform this activity primarily for treatment of severe cervical spine or neck pain. Perform the activity 10 times and evaluate how you feel. If the symptoms decrease or centralize, continue the activity as outlined below. If pain increases or numbness and tingling is present in the fingers, stop the activity and seek advice from a physician or physical therapist for an in-person evaluation. For treatment of neck pain, perform the activity 10 times per session, 6 to 8 times throughout the day. Activity 7. Neck extension and lying. Extension refers to bending the head backward or looking up toward the ceiling. How to perform. Perform activity 6 before attempting, so that you can feel comfortable with the movement while lying down. Once ready to move on, start by lying on a supportive surface on your back at a freestanding edge of the bed. Place one hand under your head and slide off the edge so that your head, neck, and top of your shoulders are hanging off. This is the extended position. Support your head with your hand while lowering toward the floor. Remove your hand from supporting your head and tilt your head and neck back so that you can see as much of the floor as manageable. With your head in the extended position, rotate your head side to side about 1/2 inch each direction away from midline, using your nose as a reference. With each attempt, aim to extend your head further backwards. Perform the activity rhythmically and not too slow. Repeat the activity, making sure to go through the full range of motion that is manageable. Once you can achieve maximal extension, relax and allow your head to stay in the extended position for 30 seconds. Use your hand once again to support your head to return to neutral position. Do not sit or stand up immediately after the activity. Allow yourself to rest flat for a few minutes to allow adequate blood flow to return and avoid lightheadedness. When to perform. Perform this activity primarily for treatment of severe cervical spine or neck pain. For treatment of neck pain, perform the activity to max manageable extension 1 time per day. Now that we have reviewed each of the 7 activities, I want to share information regarding the specifics of when to perform them and for which symptoms. Please listen to each one carefully, especially the ones pertaining to the activity you will be performing. When to apply the activities. If you are in a lot of pain currently, perform activity 1, head retraction and sitting first, working to add activity 2, neck extension and sitting. Once you no longer have the severe acute pain, continue with regular activities just shared for prevention and treatment as described. What if you can't do these because of pain or it does not improve? Replace with activity 6, head retraction and lying. Working to add activity 7, neck extension and lying. Once symptoms have centralized or decreased, and you are well practiced with activity 6, you are performing the treatment correctly. If after a few days, the symptoms move towards the base or center of the neck and decrease in pain and present a stiffness, what should you do when you start to feel better? Within 2 to 3 days, once symptoms improve with lying activities, you may gradually perform less of activity 6 and 7 and start to integrate activity 1 and 2. Within a few more days, you should only be performing sitting activities, and they are providing the same pain relief as the lying activities. At this point, you will start to notice more frequent absences of pain that last longer. Now, continue activities as outlined for prevention and treatment. When you have a headache, or you are experiencing or noticing symptoms of a headache occurring, perform activity 1, head retraction and sitting, at regular intervals whenever you feel symptoms developing. Add activity 5, neck flexion and sitting, if above does not improve symptoms. This is particularly helpful for headaches that spread over the top of your head to above or behind the eyes. What if you can't do these because of pain or it does not improve? You may add overpressure during activity 1 for 1 to 2 minutes for additional relief. Perform activity 7, neck extension and lying for the next few days, while also performing activity 1 and 2. Gradually reducing activity 7 as symptoms improve. If symptoms do not improve or your headaches worsen, pause the treatment and seek advice from a physician. Lastly, I will do an overview and share some highlights from the information I shared for prevention of future cervical spine or neck issues. Maintaining good posture, which always allows for the natural curvature of the spine, should become habit. When you are not experiencing pain or stiffness, perform activity 1, head retraction and sitting, and activity 2, neck extension and sitting first. Then, perform activity 6, neck rotation. Perform 2 times per day in the morning and at night ideally. At the first sign of recurrence, be sure that you are maintaining correct posture and performing activity 1 and 2 at regular intervals, 10 times per session and 6 to 8 times per day. For acute pain onset, when neck pain strikes or you notice discomfort, maintaining good posture is essential. Always keep your head up, avoiding prolonged forward bending or looking down. Do not roll the head around and try to avoid quick movement, especially looking over the shoulder or behind your back. Always refer to this handout as needed, or when you first start performing these activities, to ensure best outcome and feel relief from the neck pain or headaches that have been bothering you for so long. I really hope you're able to use this video and refer to these activities to treat your neck pain, headaches, and finally, be relieved of the irritable discomfort that comes along with everyday activities that we just weren't aware were causing these issues. Thank you guys so much for watching. Good night, everyone. Goodbye.